I was diagnosed a year ago with type 2 bipolar disorder. It's something that, like, looking back now, I was undiagnosed throughout my mid-20s. That's when I first started noticing it.
Having babies has played a lot of toll in my depression and, postpartum depression.
I do have a daughter that was diagnosed 7 years ago with bipolar, so we've been on a very long journey.
When you have postpartum depression, the symptoms range and vary, and they're different for everybody. But the one thing that is the most common part of it is feeling alone, lack of sleep, and lack of support.
We all have issues in our life that we can't get past that, without the help of professionals. And everybody has to seek help at some time in their lives.
I often compare it to any other illness, whether it's diabetes or being born with a chronic condition. The reality is your body works the way that it works.
You need to put on this fake face all the time. It's sad.
Well, before I was diagnosed, it was self-medicating. Unfortunately, it's through addiction. When you're undiagnosed, you're trying to solve a problem that's going on.
I went through extreme therapy for 2 years. I took cognitive behavioral therapy. I took emotional regulation.
I know our community offers a lot of support. Our health center that offers these services. For me personally, I didn't go that route because I was embarrassed. My best friend still doesn't even know.
It's hard, definitely dealing with what I deal with on a daily basis without being able to talk to someone about it without judgment.
This is not something you can deal with on your own.
With my experience, and I'm talking with my own daughter, I explained to her that when you go and reach out to others and you speak to therapists or speak to a mental health specialist or anything like that, that doesn't mean there's something wrong with you. What it means is that you are trying to keep yourself healthy mentally.
Wanting to live a good life, or to live better, or to admit something isn't being weak, it's actually being strong. To reach out and ask for help is actually a strength.
A lot of people feel like they're alone when you're in depression. It's isolation is my first initial instinct. But, reaching out is definitely a big thing to help you with that. Reaching out to people that care about you, that love you, and that only want you to do good in your life.
The direction that Enoch is going is, I think, a really good direction because we are talking about mental health and the fact that there's an understanding and a support system in place.
I definitely encourage people with similar issues to seek help from the community. You can go and speak if you need to. It's whoever you feel comfortable with.
We have a lot of resources within our community. Basically, with the help portfolio, we have a mental health social worker, we have a psychiatric nurse, and then we have all the other departments, such as the wellness. They have counselors on hand. The school has, a behavior specialist, I believe. So we do have all these resources. It's a matter of us bridging those gaps and coming together to see what works best for the community and the individual needs of our nation members. So it's coming. It's a work in progress, but it's definitely on the road.